So when you think about different communities, I want you to consider your own community. So this is a map of Columbia, sorry, and you can see here's Chapel Hill. There's different parks listed here. There's walking trails that are listed here. If you think about someone who needs to walk to get to the grocery store, to get to doctor's appointments, and things like that, which older adults at some point might need to walk, or to take a bus to those areas. Consider if they live on Chapel Hill, what that would mean. How far they'd have to go to get to the walking trail, where the closest bus stop might be. Is this area safe for them to be out walking? Is it safe for them to be out walking at night? Um, do they have to walk on the street? Do they have to cross a lot of streets? Just really consider what is there and what is in the community that can be helpful and supportive. So for this individual, if they live over here on Chapel Hill, to get to a grocery store of some type, they either need to go clear down Scotts Boulevard to get to a Walmart, and it's actually further off the map where Walmart is, about at Broadway and Scott, or they need to go to Forum Boulevard and clear up here at Stadium is where the grocery store is here. So there is a pharmacy here on Chapel Hill close to Forum, but otherwise they have to go quite a few number of blocks, 10 to 20 blocks to get to either of those areas. It doesn't mean they need to move, it just means they need to consider how they can best get to those areas so that they can keep active and fit and also access things that they need. We're lucky today that so many grocery stores deliver, but not all communities have that ability. And not all communities have taxis or transportation for older adults. Columbia is set up really ideally for older adults in that we have public transportation. We have several different resources for transportation for those who are either older or have disabilities. We have transportation and walking paths to get to quite a few areas, and other community resources where some resources or areas in rural settings won't have that type of access, and people will have to consider different mechanisms. You'll do some things like this in community nursing later on, but I think it's always interesting to really take a look at your environment and see what you would have to do to get access to different resources in your area. Intellectual programs are occurring all across every community, from the local bookstores, art classes, book clubs, all different types of things. You can take classes here in Columbia on different types of computer skills, art classes, film screenings. But getting together and talking and engaging your brain is important, and it's a way to keep yourself healthy and active. So consider how you might be able to encourage your patients and residents to also be active and engaged. Functional consequences theory, like I mentioned before, is a way that we can examine health in a more holistic manner. It explains relationships amongst person, health, nursing, and environment, and it also looks at promoting wellness. So we're looking at the older adult, and we're looking at age-related changes, negative functional consequences and risk factors, different nursing interventions, wellness, and health, and we're also looking at all that, the rest of this, so social environment, and individual, mental, body, spirit, the entire holistic package. We'll talk a little bit more about how we use functional consequences theory to promote health and wellness in older adults. Other concepts that underlie functional consequences theory, these combinations of age-related changes and risk factors definitely increase vulnerability to negative functional consequences. Nurses assess age-related changes, risk factors, and functional consequences, and they look at or identify factors that can be addressed. What can be improved for this person? What can we change? And yes, we have some things we can't change, but there are all these things that are positive and that we could change. And then wellness outcomes enable that functionality at the very highest level despite the presence of age-related or physiological changes and risk factors.